H1N1 is a new influenza strain that's circulating, and it was first reported in Mexico, and it's believed to be a combination of swine genes, avian genes, and human genes. The name swine flu was associated with this particular strain because when laboratory tests showed that many of the genes in this new virus were very similar to influenza viruses in pigs, the name was just an appropriate fit. It's likely that the influenza strain that's common in pigs mutated and became the virus that we're seeing today. People are infected the same way as they are with seasonal flu, and it's spread the same way as well. The severity of H1N1 is very similar to seasonal flu, and it varies. Like I said, in some people, they might have a mild case of it and be sick for 2 or 3 days, and then other people might require hospitalization. What's different about this is how rapidly it's spread and just how many people it's affected. There are several deaths across the country and around the world. Thankfully, there have been no deaths associated with swine flu in Dallas County. Dallas County Health and Human Services Department does want to try to make the environment as safe as possible. In addition to the new CDC guidelines that were released recently that detail school closures and how school superintendents and school officials handle school closures when there is a flu outbreak, school superintendents will work with local health departments in determining when a school closure is necessary. The CDC and local health departments realize that school closures impose on parents. These new guidelines have been released to kind of help alleviate some of the stress involved with school closures. And so in addition to the school closure guidelines that the CDC has released, Dallas County Health and Human Services Department are currently working on an educational campaign to help schools prepare. You can see posters that we prepared for schools at all levels, elementary, middle school, and high school, and then also flyers for parents on, that give them tips what they can do, what their children can do to protect themselves from the flu. And then also we're going to continue the surveillance with our schools. When a child is absent, we are asking parents to call the school and let them know why their kid is absent. That way, if there is an outbreak, it's something that we can track quicker and easier. And so the combination of the educational campaign, the surveillance that we are continuing with our schools, and also the CDC recommendations on the school closures are what we're doing to help ensure that our children are safe this fall. Another thing that we encourage is to have the entire family vaccinated. What we're hearing from the federal government is that a vaccine hopefully will be available by mid-October. The CDC has already outlined what they call priority groups, such as pregnant females, people who care for children under 6 months of age, such as daycare workers, also people with underlying medical issues. Things that you can do to protect yourself. Just please remember, wash your hands as frequently as possible. Use hand sanitizer. When you wash your hands, use soap and water. Because the germs are spread so easily by our hands, that's the best advice that we can give. Also, get vaccinated for seasonal flu.